This is Average Joe PT, and on last episode we talked specifically about some stretches to reduce your lower back chronic pain. I'll leave a link up there. Hopefully you'll watch that one after you watch this one. This episode specifically is about one exercise about reducing or resolving that radicular pain coming from a herniated disc. Just one exercise. So let's go ahead and stay tuned. Are you serious? One exercise? Yes. One exercise to resolve your radicular symptoms. Now, it's shown all over the internet. I want to show you the progression of the exercise and how you should do it so that you don't irritate the joint. So let's go ahead and give a good idea of the anatomy of this piece before we get started with the actual exercise. So we're going to lay down here exactly how you're going to lay down on the floor or on the bed. And you're going to lay down in this position, and specifically in this position because of one reason. When we go ahead and we look at why it's pulling like that, why it's giving you the symptoms is because of that radicular pushing. And we want to go ahead and try and push that disc back into place and kind of hold it there so the scar tissue can lay down and keep that from pushing back out again. And how we do that is having you initially in this position, because the injury that caused the problem in the first place was this position, was this kind of flexed over bent position. So the first thing we need to do is immediately get out of that position. And so you want to stay away from sitting, number one. You want to stay away from lifting, number two. And you want to stay away from three, anything that puts you in this kind of rounded letter C position. Anything that puts you in that letter C position, you need to get out of it immediately, because you're just reinforcing that disc to get pushed right back out again. Pushed out, pushed out, pushed out. So I want you to think about that when you're pushing out like that and you're getting the radicular symptoms down your legs and you're like, why is it hurting me again? Because you've somehow pushed that right back out again and causing the symptoms down your legs and getting that nerve irritated. We don't want to get that nerve irritated. That's the last thing we want to do, is get that nerve irritated. So I want you to go ahead and we're going to start out with that exercise right now. Now, when we look at that exercise specifically, what's it all about mechanically? We're putting this spine not only in this position, but we're going to start to extend it up. That's right, we're going to extend that back up. But we're going to start out in this nice, easy position. Let me show you on the little guy here. So when we look at this position here, we want to go ahead and just gently come up, hold for 3 to 5 seconds, and then come back down. Come back up, hold the 3 to 5 seconds, and then come back down. Now, the next thing you want to do is just come up and sustain right on your elbows. And what that's going to do is going to hold this position right here, just like this. Hold for, again, 3 to 5 seconds, and then back down. I want you to try 10 of those. If you're starting to get increased leg symptoms, back off. All I want you to do is go back to just coming up, holding for a few seconds, and then coming back down. Don't sustain coming up on and staying on your elbows. Just come back down, just like a little seesaw. So when you see it from this view, it's coming up, it's coming down. So when you see it from this view, it's coming up and it's coming down. So you're really getting a nice pivot motion where initially you were just kind of rounding out like a letter C. Now you're going ahead and you're just coming right in the opposite direction. Now, if both of those are just too much for you, what I want you to do is just go onto your stomach. I want you to put a pillow underneath your belly right here, just like my hand's doing, just like my fingers. And you're just going to hold this position. What it's going to do is at least keep you in a nice, elongated, straight position, staying out of that flex position. And I want you to stay there for probably about 10 to 15 minutes to see if your leg symptoms calm down. You might even want to throw some ice on top of it. And then just go ahead and rinse and repeat. I want you to do this at least a couple times a day. You should have less leg symptoms and you should have more back symptoms. That's actually a positive sign of recovery. So if you like this episode, I want you to go ahead and leave me a thumbs up. Go ahead and subscribe down below, hit the bell, and hopefully we'll get this out to more people so we can actually help them to do things the correct way. Because you can see, you can do the exercise, but if you're holding it for too long, you're going to get inflamed. If you're holding it not long enough, you're not going to get to recovery. So you want that nice 3 to 5 seconds. And if it seems to be aggravating you, I want you to back off. Go back to just staying down flat. Don't come up on your elbows like I'm going to show you on Big Guy here. If you can tolerate sustaining this position up on your elbows, that's great. 5-10 seconds and then back down. But if it feels like you're starting to get a lot of pain down your legs from it, then go back to the seesaw. Up and down, nice and easy. Don't sustain up on that elbow. So that's really the caveat right there that a lot of people miss out on when they do this exercise. Mindfulness, one more thing. If all of a sudden you're just having localized low back pain and no leg symptoms, you know you're under recovery. You should also have a lot less numbness and burning in the leg at the exact same time. If you have any questions, leave me a DM down below. I'd love to hear from you guys, positive, negative. All right, and until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.